In this video, we will discuss about a traditional Chinese treatment medicine, that is Baicalin, that is used for the treatment of this treatment, or we can say elevation of the problems that arises because of this chronic pancreatitis. So we have discussed in our previous videos in brief about this chronic pancreatitis and how it will trigger a vicious cycle that will leads to uh, a everlasting pancreatic inflammation. So let us first understand how this pancreatic inflammation triggers and what are the signaling pathways that will activate it, and that leads to a uh, cascade effect. So whenever there is a mutation, or when there is a mutation in the pancreatic organs at the uh, epithelial cells, then if these mutations will trigger the uncontrolled growth rate of the pancreatic cells, then that will cause a pancreatic inflammation, and this will trigger the signaling pathway, that is TGF beta type 1 receptors, and this TGF beta type 1 receptors will lead to phosphorylation of this TUC1, and this phosphorylation of TUC1 will trigger the pathway, that is phosphorylation will trigger the phosphorylation of this IKB alpha, and in case of no pancreatic inflammation, this IKB alpha will continuously degraded. So uh, there is no trigger there is no further triggering of the there is no further triggering of the pathways that will cause pancreatic inflammation. However, in case of pancreatic inflammation, the phosphorylation of IK beta alpha will leads to its interaction with this NF nuclear factor kappa beta P65, and this combined complex will trigger the upregulation of P65. And because of this, what happens is that the two kinds of things happen. First one is the upregulation of col A1, and this will go into the ECM and ECM production, and as the uncontrolled growth rate, pancreatic cells or the mutated cells are at the ECM level, so this will trigger the further upregulation. This might trigger further upregulation of these mutated cells, and that will cause the further enhancement of pancreatic inflammation. So this is one way how the pancreatic inflammation works. And another thing is that might happen, will happen in case of chronic pancreatitis, is that the upregulation of MCP1 or MCP1 production will increase, and this will leads to recruitment of macrophages, as this is uh, harmful, as this MCP1 is harmful to the cells. This will trigger the recruitment of macrophages, and this macrophages recruitment near the pancreatic near the pancreatic organ will leads to further pancreatic inflammation, as these uh, disrupt macrophages will try to disrupt the mutated pancreatic cells. So this further enhancement of pancreatic inflammation will further this further exaggerated the production of TGF beta, and this will trigger the continuous or cascade effect, or we can say the vicious cycle. So how this Baicalin works is that Baicalin works in two ways. First one is that it will reduce or inhibit this TGF beta type 1 receptor. So because of that, there is no phosphorylation of TUC1, and thus there is no this phosphorylation of IK beta alpha, and this will continuously degrade, and there is no complex formation occurs between IK beta alpha and nuclear factor kappa beta P65. And when there is no complex formation, it will not lead to upregulation of P65. Thus this MCP1 production will also get inhibited, and this decrease in the MCP1 production will leads to less recruitment of these macrophages in the pancreatic areas, and thus the patients will not face this chronic pancreatitis problem. And this one more thing that might happen, that might happen is that this alpha SMA1 collagen 1, we can say the collagen A1 production at the ECM level, at the ECM, that is extracellular matrix production will also get reduced, as there is no upregulation of this P65 that will trigger this ECM, high ECM production. And these things are being validated in both in vitro and in vivo studies. So this is how this Baicalin, that is a Chinese a Chinese traditional medicine that is used to work to reduce or alleviate the effect of this chronic pancreatitis. If you need to understand this thing in details, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.